Ever wondered what a hernia is and how it can be treated? The answer lies in understanding this common medical condition and exploring the options available, including hernia repair surgery. A hernia occurs when an organ pushes through an opening in the muscle or tissue that holds it in place. This can happen in various parts of the body, leading to different types of hernias, like inguinal, umbilical, and hiatal hernias. These troublesome hernias often reveal themselves through symptoms like bulging, pain, and discomfort. If you recognize these signs, it's crucial to seek medical attention promptly. Diagnosing a hernia typically involves physical exams and imaging tests. While some hernias may respond to non-surgical treatments such as lifestyle modifications and hernia belts, others may require a more definitive solution: hernia repair surgery. Hernia repair surgery aims to reduce pain and prevent complications. Surgeons use different techniques for this procedure, including open repair and laparoscopic repair. Each approach has its own set of advantages and disadvantages, which should be discussed thoroughly with your healthcare provider. Recovery from hernia repair surgery involves post-operative care and certain activity restrictions to ensure a successful healing process. It's normal to have concerns and questions about this process, and your healthcare provider is there to address them all. Like any surgery, hernia repair comes with potential risks and complications. It's crucial to have a frank conversation with your healthcare provider about these possibilities before deciding on surgery. Hearing from individuals who have undergone hernia repair surgery can provide valuable insights into the recovery journey and outcomes post-surgery. Their experiences highlight the role of hernia repair surgery in managing this medical condition effectively. In summary, hernia repair surgery is a vital tool in the treatment of hernias. It reduces pain, prevents complications, and helps patients return to their normal lives. However, it's essential to consult with a healthcare provider for personalized advice based on your specific medical needs. So don't let a hernia hold you back. Take control of your health today by understanding your treatment options and making informed decisions about your care.